Question: how does testosterone impact men's health? Answer: testosterone plays a significant role in men's health, influencing various physical, mental, and emotional aspects. As the primary male sex hormone, it's produced in the testicles and is crucial for the development of male characteristics. Testosterone impacts muscle mass, bone density, hair growth, and voice depth. Beyond physical traits, it's essential for overall health, regulating mood, energy levels, and even cognitive function. A primary role of testosterone is to support muscle growth and strength. Higher levels of testosterone during puberty and early adulthood facilitate muscle mass development, which contributes to strength and endurance. Additionally, testosterone is vital for maintaining bone density. Low levels of testosterone in aging men increase the risk of osteoporosis, making bones fragile and more prone to fractures. Testosterone also significantly impacts libido and sexual health. It drives sexual arousal and supports sperm production. Low testosterone levels can reduce libido, cause erectile dysfunction, and affect sperm quality, which may impact fertility. For men aiming to maintain a healthy reproductive system, optimal testosterone levels are essential. The hormone also plays a part in mood regulation and emotional well-being. Low testosterone levels can lead to mood swings, irritability, fatigue, and symptoms similar to depression. Research shows that low testosterone may contribute to a lack of motivation and feelings of tiredness, affecting a man's overall quality of life. Addressing low testosterone levels, when appropriate, can sometimes improve mood, boost energy, and increase feelings of motivation. Testosterone levels naturally decline with age, typically beginning around age 30. Question: what lifestyle factors can contribute to male infertility? Answer: male infertility can be influenced by a variety of lifestyle factors that affect overall health and reproductive function. One of the most significant contributors is poor diet. Diets high in processed foods, trans fats, and low in essential nutrients like antioxidants, zinc, and vitamins can impact sperm quality and count. On the flip side, a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can support healthy reproductive function. Another major factor is obesity. Excess body weight, particularly abdominal fat, can lead to hormonal imbalances, lowering testosterone levels and affecting sperm production. Maintaining a healthy weight through regular physical activity and a balanced diet is essential for reproductive health. Tobacco use and alcohol consumption are also significant contributors to male infertility. Smoking has been shown to decrease sperm count, motility, and morphology, while excessive alcohol can negatively affect hormone production, reduce sperm quality, and impair sexual function. Reducing or eliminating these substances can improve fertility prospects. Environmental toxins, such as pesticides, heavy metals, and industrial chemicals, can disrupt hormone levels and lead to lower sperm quality. Exposure to heat, such as from tight clothing or prolonged use of hot tubs, can raise scrotal temperature and negatively affect sperm production. Men working in environments with high levels of chemicals or heat should take precautions to reduce exposure. Chronic stress can also play a role in male infertility. High stress levels can interfere with hormone production, including those responsible for sperm production, potentially leading to lower sperm counts and motility. Question: what are common prostate health issues? Answer: common prostate health issues can significantly impact men, especially as they age. Here are some of the most frequent concerns. Benign prostatic hyperplasia, BPH. This is a non-cancerous enlargement of the prostate gland that typically affects older men. As the prostate enlarges, it can press against the urethra, causing urinary issues such as difficulty starting or stopping urination, frequent urination, especially at night, nocturia, and a weak urine flow. While not life-threatening, BPH can greatly affect quality of life due to its symptoms. Prostatitis. This condition is the inflammation or infection of the prostate gland and can affect men of any age. Prostatitis is often categorized as either bacterial or non-bacterial. Bacterial prostatitis, either acute or chronic, is caused by bacterial infections and is treatable with antibiotics. Non-bacterial prostatitis, or chronic pelvic pain syndrome, can be more complex and is sometimes associated with discomfort in the pelvic area, lower back pain, and urinary difficulties. Symptoms can vary and sometimes mimic those of BPH or a urinary tract infection, UTI. Prostate cancer. This is one of the most common cancers in men worldwide. Early-stage prostate cancer often doesn't present symptoms, which is why screening is essential for early detection. When symptoms do appear, they may include difficulty urinating, blood in urine or semen, pain in the pelvic area, and issues with erectile function. The risk of prostate cancer increases with age, family history, and certain lifestyle factors. Early detection can significantly improve treatment outcomes, which often include surgery, radiation therapy, and, in some cases, hormone therapy. Question: how does stress affect men's health? Answer: stress can have a profound impact on men's health, both physically and mentally. When faced with stress, the body enters a fight-or-flight response, releasing stress hormones like cortisol and adrenaline. While these hormones can be helpful in short bursts, chronic stress can lead to several health issues. Physically, long-term stress can contribute to high blood pressure, which increases the risk of heart disease and stroke. The heart has to work harder under constant stress, potentially leading to arrhythmias, irregular heartbeats, or heart attacks. Stress can also weaken the immune system, making men more susceptible to infections and illnesses. Chronic stress is linked to metabolic issues such as weight gain, particularly around the abdomen, which can lead to obesity and increase the risk of diabetes. Additionally, high levels of stress have been associated with digestive problems, like irritable bowel syndrome, IBS, and can exacerbate pre-existing conditions like ulcers. Mentally, stress can lead to anxiety and depression. Men may experience mood swings, irritability, and feelings of being overwhelmed. The pressure of constantly dealing with stress can lead to burnout, reducing one's ability to cope with everyday challenges. In some cases, prolonged stress can contribute to a lack of motivation and energy, affecting personal relationships and work performance. Men under stress are also more likely to engage in unhealthy coping mechanisms such as smoking, drinking alcohol, or overeating, which can further deteriorate overall health. Managing stress is essential for men to maintain good health. Regular physical activity, a balanced diet, adequate sleep, and mindfulness practices like meditation or yoga can help reduce stress levels. Seeking support through therapy or talking to loved ones about stress can also provide relief. Question: how can men prevent common injuries during exercise? Answer: preventing injuries during exercise is crucial for maintaining long-term fitness and health. Here are several strategies men can use to minimize the risk of common injuries. Warm up properly. Before starting any workout, it's essential to warm up your muscles. A good warm-up increases blood flow to your muscles, which enhances flexibility and reduces the risk of strains and sprains. A dynamic warm-up, like light jogging, arm circles, and leg swings, prepares the body for more intense physical activity. Use proper technique. Many injuries happen when exercises are performed with incorrect form. Whether you're lifting weights, running, or performing any other activity, ensure you understand and use the correct technique. If you're unsure, consider working with a trainer, especially when starting a new routine. Progress gradually. Avoid overloading your muscles by starting too heavy or pushing yourself too quickly. Gradually increase the intensity and duration of your workouts. If you're lifting weights, aim to increase the weight by small increments to prevent strain. Cross-train. Engaging in a variety of exercises helps prevent overuse injuries. When you stick to one type of exercise for an extended period, certain muscle groups can become fatigued, while others may be underworked. Cross-training ensures that different muscle groups are trained, promoting overall muscle balance and reducing the likelihood of injury. Rest and recover. Rest is just as important as exercise itself. Give your muscles time to recover between workouts, especially after intense sessions. Overtraining can lead to fatigue and injuries. Getting adequate sleep and incorporating active recovery techniques like stretching, foam rolling, or yoga can help promote muscle healing. Wear appropriate gear. Make sure you're wearing the right shoes for your exercise type. Question: what are the signs of testicular cancer? Answer: Testicular cancer is a type of cancer that affects the testicles, and it is most commonly found in men between the ages of 15 and 35. Early detection plays a crucial role in the effective treatment and management of this condition. The following are common signs and symptoms associated with testicular cancer: lump or swelling in the testicle. One of the most noticeable signs of testicular cancer is the presence of a painless lump or swelling in one of the testicles. The lump may vary in size, but typically feels firm to the touch. Pain or discomfort in the testicle or scrotum. While some lumps are painless, others may be accompanied by pain or a dull ache in the testicle or scrotum. This discomfort can be sudden or gradual. Change in the size or shape of the testicle. Men may notice that one testicle has become larger than the other, or the shape of the testicle may change. This could occur along with or without a lump. Heaviness or discomfort in the scrotum. A sensation of heaviness or a feeling of fullness in the scrotum may develop as the tumor grows. Lower back pain. If cancer spreads beyond the testicle, it can affect the lymph nodes in the abdomen, causing pain or tenderness in the lower back. Pain in the abdomen or groin. Some individuals may experience pain in the lower abdomen or groin area, which may indicate the spread of cancer to nearby structures. Enlarged or swollen breasts. Gynecomastia. Although less common, testicular cancer can cause hormonal imbalances that lead to the growth of breast tissue in men, known as gynecomastia. Fatigue or general unwell feeling. As with many types of cancer, testicular cancer may cause unexplained fatigue, weight loss, or a general feeling of being unwell. While these symptoms may indicate testicular cancer, they can also be caused by other conditions. Question: what are the mental health challenges men face? Answer: men often face unique mental health challenges that are influenced by societal expectations, gender roles, and personal experiences. These challenges can include a reluctance to seek help due to stigma, stress from trying to meet traditional standards of masculinity, and difficulties in expressing emotions. These factors may contribute to conditions like anxiety, depression, and substance abuse. One of the most significant challenges men face is the stigma around mental health. In many cultures, there is a strong expectation for men to be stoic and emotionally resilient. This can make it difficult for men to express vulnerability, leading them to suppress emotions such as sadness or fear. This emotional suppression can increase stress and contribute to mental health issues like depression or anxiety. Men are also more likely to avoid seeking professional help when struggling with mental health concerns. Many men may feel pressure to tough it out and avoid talking about their feelings. This reluctance to ask for support can delay diagnosis and treatment, potentially worsening the mental health issue over time. Men are also at a higher risk for engaging in harmful coping mechanisms, such as excessive alcohol consumption or substance abuse, as a way of managing stress and emotional pain. Moreover, men are often less likely to talk openly about their mental health with friends or family members. This lack of social support can make men feel isolated and disconnected, further exacerbating feelings of loneliness or hopelessness. It can also lead to a sense of shame or embarrassment, which can prevent men from taking proactive steps to improve their mental well-being. In addition, life events such as career pressures, relationship challenges, or financial struggles can place significant stress on men's mental health. Question: what are the benefits of regular physical exams for men? Answer: regular physical exams for men are essential for maintaining overall health and well-being. These checkups provide a proactive approach to detecting potential health issues before they become serious. One of the key benefits is early detection of chronic conditions such as high blood pressure, diabetes, and high cholesterol. By identifying these risks early, lifestyle changes or treatments can be implemented to manage and even prevent further complications. Additionally, regular physical exams help monitor overall health metrics, including weight, blood sugar levels, and heart health, allowing doctors to identify patterns or concerns that might not be noticeable otherwise. This is particularly important as many health issues, such as high cholesterol or certain types of cancer, can develop without obvious symptoms in the early stages. Another significant benefit is the opportunity to build a relationship with a healthcare provider who is familiar with your medical history. This trust allows for more personalized care, where you can address specific concerns, ask questions about your health, and discuss prevention strategies tailored to your lifestyle. Physical exams also help with mental health maintenance. Regular checkups provide a platform to discuss stress, mental health concerns, or changes in mood with a doctor, ensuring both physical and mental well-being are addressed. This is especially important as men are less likely to seek help for mental health issues on their own. Lastly, regular exams are an opportunity for immunizations, screenings, and preventive measures, which may include cancer screenings, like prostate or colorectal cancer, or vaccinations to ensure continued protection against diseases. Question: how can men maintain heart health? Answer: maintaining heart health is crucial for men as they age, especially since heart disease is one of the leading causes of death. To keep the heart in optimal condition, lifestyle choices play a significant role. Here's how men can maintain heart health: eat a heart-healthy diet. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats is key. Reducing the intake of saturated fats, trans fats, and cholesterol helps lower blood pressure and cholesterol levels. Foods like leafy greens, fish high in omega-3 fatty acids, salmon, mackerel, nuts, and seeds are excellent choices. Exercise regularly. Physical activity is one of the most effective ways to boost heart health. Engaging in at least 150 minutes of moderate intensity exercise per week, such as brisk walking, cycling, or swimming, or 75 minutes of vigorous exercise can strengthen the heart, improve circulation, and lower blood pressure. Control blood pressure. Hypertension, high blood pressure, is a major risk factor for heart disease. Regular monitoring and maintaining blood pressure within healthy limits, below 120/80 mmHg, through a healthy diet, regular exercise, and, when necessary, medication can significantly reduce heart disease risk. Maintain a healthy weight. Being overweight or obese increases the strain on the heart and raises the risk of heart disease. Achieving and maintaining a healthy weight through proper diet and exercise helps lower this risk. Limit alcohol intake. Excessive alcohol consumption can raise blood pressure, increase triglycerides, and contribute to heart disease. Men should limit alcohol to no more than 2 drinks per day. Quit smoking. Smoking damages the blood vessels, raises blood pressure, and reduces the amount of oxygen in the blood. Question: what are the risks of untreated erectile dysfunction? Answer: untreated erectile dysfunction, ED, can significantly impact both physical and mental health, as well as overall quality of life. ED often goes beyond the inability to achieve or maintain an erection. It can be a symptom of underlying health issues that need attention. Here's how untreated ED affects different aspects of health. Heart health. ED can be an early warning sign for cardiovascular disease. The blood vessels in the penis are smaller and may show signs of damage earlier than in other areas. When ED is ignored, potential cardiovascular problems like high blood pressure, atherosclerosis, narrowing of the arteries, or even a heart attack may go undetected and untreated. By addressing ED, you may discover and manage conditions that affect heart health, mental health, and self-esteem. ED can lead to feelings of embarrassment, frustration, and low self-esteem. Men with untreated ED often experience stress, anxiety, and in some cases, depression. These mental health challenges can further worsen ED, creating a cycle that's difficult to break. Addressing ED with treatment can help improve self-confidence and reduce anxiety. Relationship strain. ED can cause tension and misunderstandings in romantic relationships. Without treatment, the lack of physical intimacy can lead to feelings of disconnection or inadequacy for both partners, potentially leading to relationship issues. Open communication and seeking treatment can help rebuild intimacy and trust. Hormonal imbalance. ED may indicate low testosterone levels, which can affect energy, mood, and libido. Untreated low testosterone can lead to fatigue, reduced muscle mass, increased body fat, and diminished mental focus. Addressing ED may prompt testing for testosterone levels. Question: how does obesity impact overall health? Answer: obesity is a complex health issue that significantly affects overall health and well-being. It is defined as an excessive accumulation of body fat, which can lead to numerous health complications. One of the primary impacts of obesity is its association with chronic diseases. Obese individuals are at a higher risk of developing conditions such as type 2 diabetes, hypertension, cardiovascular diseases, and certain types of cancer. The excess fat in the body can disrupt normal metabolic functions, leading to insulin resistance and inflammation, which are critical factors in the development of these diseases. Moreover, obesity can have a detrimental effect on mental health. Individuals struggling with obesity often experience low self-esteem, anxiety, and depression due to societal stigma and discrimination. The psychological burden can create a vicious cycle where emotional distress leads to overeating, exacerbating the condition. Obesity also affects the body's musculoskeletal system. Carrying excess weight can place additional strain on joints, particularly in the knees, hips, and lower back, leading to conditions such as osteoarthritis. This can limit mobility and reduce the ability to engage in physical activity, further perpetuating the problem. Additionally, obesity impacts respiratory function. Excess fat can lead to obstructive sleep apnea, a condition where breathing is interrupted during sleep, resulting in poor sleep quality and increased daytime fatigue. This can affect overall quality of life and productivity. Overall, addressing obesity through lifestyle changes, including a balanced diet and regular physical activity, is essential for improving health outcomes. By managing obesity, individuals can reduce their risk of developing related chronic diseases, enhance their mental well-being. Question: what lifestyle changes can prevent heart disease? Answer: preventing heart disease often starts with intentional lifestyle changes that support cardiovascular health and overall well-being. Heart disease is influenced by several risk factors, including diet, physical activity, stress, and habits like smoking or drinking. By making certain adjustments, individuals can significantly lower their chances of developing heart-related issues. Adopt a heart-healthy diet. Eating nutrient-rich foods is crucial for heart health. Diets rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, like those from avocados, nuts, and olive oil, help manage blood pressure and cholesterol levels. Cutting back on saturated and trans fats, often found in processed and fried foods, reduces cholesterol and improves artery health. Limiting salt intake can also lower blood pressure, a key factor in reducing heart disease risk. Additionally, focusing on high-fiber foods, such as oats and legumes, aids in lowering cholesterol levels. Exercise regularly. Physical activity strengthens the heart, improves circulation, and helps manage weight. Aim for at least 150 minutes of moderate aerobic activity, like walking or cycling, each week, or 75 minutes of vigorous exercise. Strength training twice a week can also support heart health by increasing muscle mass and improving metabolism. Regular exercise helps maintain a healthy weight, reduce blood pressure, and improve overall cardiovascular function. Maintain a healthy weight. Excess body weight, especially around the abdomen, increases the risk of heart disease. Losing even a small amount of weight can positively impact blood pressure, cholesterol, and blood sugar levels. A balanced diet and regular physical activity are essential for reaching. Question: what is the role of medication in managing chronic diseases? Answer: medication plays a crucial role in managing chronic diseases, providing a means to control symptoms, improve quality of life, and prevent disease progression. Chronic diseases such as diabetes, hypertension, asthma, and arthritis often require long-term management strategies, and medications are often at the forefront of these approaches. For many chronic conditions, medications can help regulate bodily functions that are disrupted by the disease. For example, in diabetes, insulin or oral hypoglycemic agents help control blood sugar levels, reducing the risk of complications like neuropathy and retinopathy. In hypertension, antihypertensive medications lower blood pressure, minimizing the risk of cardiovascular events such as heart attack or stroke. Moreover, medications can help alleviate symptoms that impact daily living. Pain relievers, anti-inflammatory drugs, and muscle relaxants are commonly used in conditions like arthritis to improve mobility and comfort. Additionally, medications may also serve to prevent complications associated with chronic diseases. For instance, statins are prescribed for individuals with high cholesterol levels to reduce the risk of heart disease, However, medication management requires careful consideration and monitoring. Each individual's response to medication can vary based on genetics, lifestyle, and other health conditions. Therefore, it is essential to work closely with healthcare providers to find the most effective medication regimen, adjusting doses as necessary to achieve optimal results. In summary, medication is vital in the comprehensive management of chronic diseases, helping to control symptoms, prevent complications, and enhance the overall quality of life. While medications are not a cure, they are a powerful tool that. Question: what are the symptoms of asthma? Answer: asthma is a chronic respiratory condition where the airways become inflamed, narrow, and produce extra mucus, making breathing difficult. Recognizing asthma symptoms is crucial for proper management, as these symptoms can vary in intensity and frequency. Common symptoms include shortness of breath, one of the most noticeable asthma symptoms. This occurs when airways constrict and make it difficult to breathe normally. It's often worse during physical activity, in cold weather, or at night. Wheezing: this is a high-pitched whistling sound made while breathing, especially noticeable when exhaling. Wheezing happens due to narrowed airways and is a classic symptom of asthma. Chest tightness: many individuals with asthma describe feeling a tightness or pressure in the chest, as though something is squeezing them. This sensation can range from mild discomfort to severe pain, and it often accompanies other symptoms. Coughing: a persistent cough, particularly at night or early morning, is common among people with asthma. This cough is usually dry but can sometimes produce mucus. Exercise, cold air, and allergens can trigger coughing episodes. Difficulty sleeping: asthma symptoms are often worse at night, leading to frequent awakenings. The combination of coughing, wheezing, and shortness of breath can disrupt sleep and lead to fatigue during the day. Additional indicators and triggers. Asthma symptoms can be aggravated by certain triggers, such as allergens, pollen, pet dander, dust mites, respiratory infections, exercise, stress, and environmental factors like smoke, pollution, and strong odors. Recognizing these triggers and monitoring when symptoms appear or worsen can help with effective asthma management. Severe asthma symptoms: in severe cases, asthma symptoms escalate and require immediate medical attention. Question: what are the common risk factors for diabetes? Answer: diabetes is a chronic condition that affects millions of people globally, and understanding its risk factors is essential for prevention and early intervention. Here are some of the most common risk factors associated with the development of diabetes: genetics and family history. A family history of diabetes, particularly type 2 diabetes, can increase the likelihood of developing the condition. Certain genetic markers are associated with insulin resistance, making family history a key risk factor. Age: the risk of type 2 diabetes increases with age, especially after 45. This is partly because of lifestyle changes, hormonal shifts, and a natural decrease in muscle mass, which can make blood sugar regulation more difficult. Obesity and overweight: excess body weight is one of the most significant risk factors for type 2 diabetes. Abdominal fat, in particular, contributes to insulin resistance, where the body's cells struggle to use insulin effectively. Physical inactivity: a sedentary lifestyle is linked to a higher risk of developing diabetes. Regular physical activity helps maintain a healthy weight, improves insulin sensitivity, and keeps blood glucose levels in check, reducing diabetes risk. Poor diet choices: diets high in refined carbohydrates, sugars, and unhealthy fats can increase diabetes risk. Consuming high-calorie, low-nutrient foods and beverages, such as sugary drinks and processed foods, can lead to obesity and insulin resistance over time. High blood pressure, hypertension, or high blood pressure, is often found in individuals with type 2 diabetes. Chronic high blood pressure damages blood vessels, which can lead to insulin resistance and an increased risk of diabetes. Question: how can hypertension be managed effectively? Answer: managing hypertension effectively is essential to reduce the risk of severe complications like heart disease, stroke, and kidney damage. An effective hypertension management plan involves a mix of lifestyle changes, dietary adjustments, regular monitoring, and sometimes medication. 1. Diet and nutrition: adopting a heart-healthy diet is a key step. Dietary approaches to stop hypertension. Diet is widely recommended, focusing on foods high in potassium, calcium, and magnesium. These nutrients help control blood pressure levels. A DASH-based diet includes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while limiting red meat, salt, and sugary drinks. Reducing salt intake specifically is crucial, as sodium increases blood pressure. Aim for less than 1,500 milligrams of sodium per day, if possible. 2. Regular physical activity. Exercise plays a powerful role in managing hypertension. Regular aerobic activities like brisk walking, cycling, or swimming help lower blood pressure by strengthening the heart and improving circulation. Try to engage in at least 150 minutes of moderate intensity exercise each week, as this helps maintain a healthy weight and reduces strain on the cardiovascular system. 3. Weight management. Excess body weight is a significant contributor to hypertension. By achieving and maintaining a healthy weight, you can lessen the pressure on your heart. Even modest weight loss can make a difference. Losing just 5 to 10% of body weight can lead to substantial blood pressure reductions. 4. Limit alcohol and avoid smoking. Drinking alcohol in moderation, if at all, can help keep blood pressure under control. Question: what are the complications of untreated high cholesterol? Answer: untreated high cholesterol can lead to a range of serious health complications, primarily affecting the cardiovascular system. When cholesterol levels are elevated, it can result in the buildup of plaque in the arteries, a condition known as atherosclerosis. This plaque formation narrows the arteries and restricts blood flow, which can ultimately lead to several serious issues. One of the most significant complications of untreated high cholesterol is coronary artery disease, CAD. CAD occurs when the coronary arteries become blocked, reducing blood flow to the heart. This can result in chest pain, angina, and can lead to heart attacks, which occur when blood flow to a part of the heart is blocked for an extended period. Another serious complication is stroke. High cholesterol can contribute to the formation of blood clots that can travel to the brain, causing a stroke by obstructing blood flow to brain tissue. This can lead to permanent disability or even death, depending on the severity and duration of the blockage. Peripheral artery disease, PAD, is another potential consequence of high cholesterol. PAD occurs when plaque buildup narrows the arteries that supply blood to the limbs, often resulting in leg pain and mobility issues. In severe cases, it can lead to tissue death and the need for amputation. Additionally, untreated high cholesterol can increase the risk of developing high blood pressure, heart failure, and pancreatitis, which is inflammation of the pancreas. Moreover, elevated cholesterol levels can be associated with metabolic syndrome, a cluster of conditions that increases the risk of heart disease, stroke, and type 2 diabetes. Overall, managing cholesterol levels through lifestyle changes and, if necessary, medication is crucial to prevent these complications. Question: what is the importance of regular screenings for chronic conditions? Answer: regular screenings for chronic conditions are essential for early detection, effective management, and prevention of serious health issues. Chronic conditions such as diabetes, hypertension, heart disease, and cancer often develop silently and may not present noticeable symptoms until they reach advanced stages. By participating in regular screenings, individuals can identify potential health risks before they escalate into more severe problems, thereby increasing the chances of successful treatment. One of the primary benefits of regular screenings is that they help healthcare providers to monitor risk factors and detect changes in health status over time. For instance, routine blood pressure checks can reveal hypertension early, allowing for lifestyle changes or medications to prevent heart disease. Similarly, screening tests like cholesterol checks or blood sugar tests can identify prediabetes or dyslipidemia, giving patients the opportunity to implement preventive measures. Moreover, regular screenings can lead to improved health outcomes and reduced healthcare costs in the long run. By catching chronic conditions early, patients can often avoid more expensive treatments and hospitalizations. This proactive approach not only benefits individual health, but also alleviates the overall burden on healthcare systems. Additionally, regular screenings can empower individuals to take charge of their health. Knowledge of one's health status enables better lifestyle choices, such as adopting a healthier diet, increasing physical activity, and adhering to prescribed treatments. Education gained from these screenings can motivate individuals to make informed decisions about their health and well-being. In summary, regular screenings for chronic conditions are vital for early detection and prevention. Question: how can you manage stress-related health conditions? Answer: managing stress-related health conditions is crucial for maintaining both physical and mental well-being. Stress can exacerbate various health issues, including anxiety, depression, heart disease, and gastrointestinal disorders. Here are effective strategies to manage stress-related health conditions: mindfulness and relaxation techniques. Practicing mindfulness through meditation, deep breathing exercises, or progressive muscle relaxation can help reduce stress levels. These techniques promote relaxation and can lower blood pressure, which is beneficial for overall health. Regular exercise. Engaging in physical activity is one of the most effective ways to alleviate stress. Exercise releases endorphins, the body's natural mood lifters. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity each week, along with strength training twice a week. Balanced nutrition. A healthy diet can significantly impact stress management. Incorporate whole foods, such as fruits, vegetables, whole grains, and lean proteins, while reducing processed foods and sugar intake. Omega-3 fatty acids, found in fish, flax seeds, and walnuts, are particularly beneficial for reducing stress. Adequate sleep. Quality sleep is vital for stress management. Aim for 7 to 9 hours of sleep per night. Establish a relaxing bedtime routine, create a comfortable sleep environment, and limit screen time before bed to improve sleep quality. Social support. Connecting with friends, family, or support groups can provide emotional relief and help you cope with stress. Sharing your feelings with trusted individuals can make a significant difference in how you handle stress-related health issues. Question: how can you manage arthritis pain? Answer: managing arthritis pain requires a combination of lifestyle strategies, medical treatments, and support systems. Arthritis can be a chronic condition that causes joint pain, stiffness, and swelling, often affecting mobility and quality of life. Here are several effective ways to manage arthritis pain: exercise and physical therapy. Regular, low-impact exercise like walking, swimming, and cycling can strengthen muscles around the joints, improve flexibility, and reduce stiffness. Physical therapy is also beneficial as it provides targeted exercises that improve range of motion and muscle strength, reducing pressure on affected joints. Healthy diet. A balanced diet with anti-inflammatory foods can significantly impact arthritis pain. Omega-3 fatty acids found in fish, flaxseed, and walnuts can help reduce inflammation. Antioxidant-rich fruits and vegetables, such as berries, leafy greens, and broccoli, also help fight inflammation. Maintaining a healthy weight through balanced nutrition reduces stress on weight-bearing joints like the knees and hips, which can alleviate pain. Pain relief medications. Over-the-counter pain relievers, such as acetaminophen, ibuprofen, and naproxen, can be effective for mild arthritis pain. However, it's essential to use them as directed by a healthcare provider to avoid potential side effects. For more severe pain, a doctor might recommend prescription medications, including nonsteroidal anti-inflammatory drugs, NSAIDs, or disease-modifying anti-rheumatic drugs, DMARDs. Hot and cold therapy. Applying heat can relax muscles and increase circulation, which can alleviate stiffness. Cold therapy, like ice packs, can reduce joint swelling and numb the area, providing relief. Question: what lifestyle changes can improve fertility? Answer: improving fertility can be influenced by several lifestyle changes that promote overall health and well-being. Here are key factors to consider. Maintain a healthy diet. A balanced diet rich in vitamins, minerals, and antioxidants is essential for fertility. Foods like leafy greens, berries, whole grains, and lean proteins can boost reproductive health. Avoid processed foods high in trans fats and sugars, as these can negatively impact hormone levels and fertility. Achieve a healthy weight. Being overweight or underweight can disrupt hormone levels, making it harder to conceive. Maintaining a healthy weight through a balanced diet and regular exercise is key. For women, having too much body fat can lead to irregular periods, while too little fat can stop ovulation. Exercise regularly. Moderate exercise improves circulation, supports hormonal balance, and enhances overall health. Aim for at least 150 minutes of moderate intensity activity per week. However, excessive exercise can interfere with fertility, so finding a balance is important. Reduce stress. Chronic stress can impact ovulation and sperm quality. Managing stress through relaxation techniques like yoga, meditation, or deep breathing exercises can improve reproductive health. Quit smoking and limit alcohol. Smoking and excessive alcohol intake are known to negatively affect fertility in both men and women. Quitting smoking can improve egg quality and sperm count, while reducing alcohol intake can help regulate hormonal functions. Get enough sleep. Poor sleep patterns can interfere with hormone production, particularly the hormones that regulate ovulation and sperm production. Aim for 7 to 9 hours of sleep per night to maintain a healthy reproductive system. Question: what are the signs of pregnancy? Answer: signs of pregnancy can vary, but there are common early symptoms many people experience, especially during the first few weeks. One of the first and most common signs is a missed period, which often prompts a pregnancy test. However, other early pregnancy signs may appear before a missed period, or even after a confirmed pregnancy. One typical sign is nausea, often referred to as morning sickness. This sensation of queasiness can happen at any time of day and is often accompanied by food aversions or intense cravings. Another common symptom is fatigue. Many women feel unusually tired in early pregnancy due to rising levels of the hormone progesterone, which can make you feel sleepy and low energy. Breast changes are also common in the early weeks of pregnancy. Hormones like estrogen and progesterone increase, making the breasts feel swollen, tender, or heavier. The area around the nipples, called the areola, may darken, and small bumps, known as Montgomery's glands, may become more pronounced. Additionally, increased urination is another frequent symptom, as the body produces more blood and other fluids during pregnancy, making your kidneys work harder and resulting in a need to urinate more often. Another sign is heightened sense of smell, which can make certain smells overly intense or unpleasant. Mood swings and emotional sensitivity can also occur due to hormonal changes, leading to fluctuating emotions and increased sensitivity. Light spotting, known as implantation bleeding, can happen around 6 to 12 days after conception as the fertilized egg attaches to the uterine lining. This is usually lighter than a normal period and often only lasts a few days. Some people may experience cramping similar to menstrual cramps, which can feel confusing but is usually a normal part of early pregnancy as the uterus begins to expand. Question: how does hormonal birth control work? Answer: hormonal birth control is a widely used method of contraception that works by altering a woman's natural hormonal cycle to prevent pregnancy. It primarily involves the use of synthetic versions of the hormones estrogen and progesterone, or just progesterone, to regulate the reproductive system. There are several ways hormonal birth control works. Prevents ovulation. The primary way hormonal birth control prevents pregnancy is by stopping ovulation. Ovulation is the release of an egg from the ovary, which is necessary for fertilization. The hormones in birth control pills or other forms, patch, ring, injection, suppress the pituitary gland's ability to signal the ovaries to release an egg. Thickened cervical mucus. Hormonal contraceptives also cause the cervical mucus to thicken. This makes it more difficult for sperm to swim through the cervix and reach an egg, further reducing the chances of fertilization. Thins the uterine lining. Hormonal birth control also affects the lining of the uterus, endometrium, making it thinner and less suitable for implantation. Even if an egg is fertilized, it is less likely to successfully implant and develop in the uterus. Types of hormonal birth control include oral contraceptives, pills taken daily, containing a combination of estrogen and progesterone or just progesterone, contraceptive patch, worn on the skin, releasing hormones continuously for a week at a time. NuvaRing, a flexible ring inserted into the vagina, releasing hormones over 3 weeks. Injectable birth control, Depo-Provera, a shot administered every 3 months. Implants, small rods placed under the skin that release hormones for up to 3 years. while hormonal birth control is highly effective, it does not protect against sexually transmitted infections, STIs. Question: how can you prevent urinary tract infections? Answer: urinary tract infections, UTIs, are common but preventable conditions that affect many individuals. There are several key strategies you can adopt to reduce the risk of developing a UTI. Hydrate regularly. Drinking plenty of water helps flush out bacteria from the urinary system. It's important to maintain hydration, as it dilutes urine and encourages more frequent urination, which can help prevent bacteria from building up. Wipe from front to back. This is particularly important for women, as wiping from back to front can introduce bacteria from the rectal area into the urinary tract. Always wipe from front to back to reduce this risk. Urinate after sex. Sexual activity can introduce bacteria into the urethra. Urinating soon after intercourse helps flush out any bacteria that may have entered the urinary tract. Avoid irritants. Certain feminine products, like douches, powders, and sprays, can irritate the urethra and increase the risk of a UTI. It's best to avoid these products and opt for mild, unscented soaps. Wear breathable clothing. Tight-fitting clothes and underwear made from synthetic fabrics can trap moisture and heat, promoting the growth of bacteria. Choose loose-fitting clothes and underwear made from cotton to keep the genital area dry. Empty your bladder fully. Always make sure to empty your bladder completely when urinating. Holding in urine for long periods of time can allow bacteria to grow in the urinary tract. Cranberry products. Some studies suggest that cranberry juice or supplements may help prevent UTIs by preventing bacteria from sticking to the urinary tract walls. However, more research is needed to confirm its effectiveness. Probiotics. Probiotics can help maintain a healthy balance of bacteria in the urinary tract and gut, potentially reducing the likelihood of infections. Question: how can women manage menopause symptoms? Answer: menopause is a natural phase in a woman's life marking the end of menstrual cycles, typically occurring in the late 40s or early 50s. Although it is a natural process, menopause can bring physical, emotional, and hormonal changes that vary from mild to intense. Understanding how to manage these symptoms can greatly improve well-being and quality of life during this transition. One of the most common symptoms is hot flashes, sudden feelings of warmth that can disrupt daily life and sleep. To manage these, women can try lifestyle adjustments such as wearing light, breathable clothing, keeping the room cool, and practicing deep breathing exercises to reduce the intensity. Regular exercise can also help regulate body temperature, improve mood, and promote better sleep, reducing night sweats. Yoga, Tai Chi, or simple stretching routines can be beneficial for overall relaxation and stress management. Hormone replacement therapy, HRT, is another option for those experiencing severe symptoms. HRT replenishes estrogen levels, potentially alleviating hot flashes, mood swings, and vaginal dryness. However, HRT is not suitable for everyone, so it's crucial to consult with a healthcare provider to assess the benefits and risks based on personal health history. Diet also plays a significant role. Foods rich in calcium and vitamin D support bone health, which is essential as menopause can lead to bone density loss. Including fruits, vegetables, lean proteins, and whole grains helps maintain a balanced diet and stabilize blood sugar levels, which can impact mood. Phytoestrogens, found in foods like soy, flaxseed, and lentils, may help balance hormones naturally, although their effects vary from person to person. For those experiencing mood swings, mindfulness and relaxation techniques. Question: what are the benefits of regular gynecological exams? Answer: regular gynecological exams play a vital role in maintaining overall health, particularly in women's reproductive and sexual health. These exams are crucial for early detection of potential issues, including cervical cancer, sexually transmitted infections, STIs, and other reproductive system disorders. They also help monitor conditions like fibroids, endometriosis, and ovarian cysts, which can cause significant health issues if left untreated. One of the most significant benefits of regular gynecological exams is the screening for cervical cancer through Pap smears or Pap tests. These tests can detect abnormal cells early, allowing for prompt treatment and significantly reducing the risk of cancer progression. Additionally, gynecological exams may include an HPV test, which screens for the human papillomavirus, a common cause of cervical cancer. These exams also offer the opportunity to assess overall reproductive health. Regular screenings help detect signs of conditions like polycystic ovary syndrome, PCOS, and other hormonal imbalances that can affect menstrual cycles, fertility, and overall well-being. Early detection can lead to better management and treatment of these conditions, potentially preventing complications down the line. During a gynecological exam, women can also discuss contraceptive options, family planning, and sexual health. A healthcare provider can offer advice on the most suitable birth control methods, whether it's hormonal, barrier methods, or permanent solutions like sterilization. For women approaching menopause, gynecological exams provide a chance to discuss symptom management and ensure that hormonal changes are properly monitored. Moreover, these exams allow women to build a trusting relationship with their healthcare provider. Question: what are common menstrual cycle issues? Answer: ChatGPT. Menstrual cycle issues are common and can vary significantly from person to person, but they generally stem from hormonal imbalances, lifestyle factors, or underlying health conditions. Here are some of the most common menstrual cycle issues many people experience. Irregular periods. A typical menstrual cycle lasts about 28 days, but anything between 21 to 35 days can be considered normal. Irregular periods occur when cycles vary in length or come unexpectedly. Causes can include stress, weight fluctuations, thyroid disorders, or polycystic ovary syndrome, PCOS. Addressing lifestyle factors and consulting a healthcare provider can help regulate cycles. Heavy menstrual bleeding, menorrhagia. Some individuals experience excessive bleeding during menstruation, which can last more than 7 days or require frequent tampon or pad changes. This may be due to fibroids, hormonal imbalances, or bleeding disorders. It can lead to anemia, fatigue, and discomfort, so medical intervention is often necessary to identify and manage the cause. Painful periods. Dysmenorrhea. Many people experience cramping and pain during their period, but some endure severe discomfort that disrupts daily activities. This may be due to high prostaglandin levels or conditions like endometriosis, adenomyosis, or pelvic inflammatory disease. Treatment can range from over-the-counter pain relievers to prescribed therapies for more severe cases. Premenstrual syndrome, PMS, and premenstrual dysphoric disorder, PMDD. PMS includes symptoms like mood swings, bloating, and fatigue before menstruation, while PMDD is a more severe form that affects emotional well-being intensely. Both are linked to hormonal fluctuations in the cycle. Question: how can women maintain reproductive health? Answer: maintaining reproductive health is essential for women at every stage of life, and it involves a combination of lifestyle choices, regular screenings, and awareness of potential health risks. Here are some ways women can maintain reproductive health: regular gynecological checkups. Routine visits to a gynecologist or healthcare provider are crucial for detecting potential issues early. Regular screenings such as pap smears, pelvic exams, and breast exams can help identify abnormalities such as infections, cervical cancer, or fibroids. Balanced diet and exercise. A well-balanced diet rich in vitamins, minerals, and antioxidants supports hormonal balance, fertility, and overall reproductive health. Regular physical activity helps maintain a healthy weight and reduce the risk of conditions like polycystic ovary syndrome, PCOS, and endometriosis, which can affect reproductive health. Understanding menstrual cycles. Tracking menstrual cycles and understanding the signs of ovulation can help identify issues such as irregular periods, which can indicate hormonal imbalances or other underlying health problems. Safe sexual practices. Practicing safe sex and using protection, such as condoms, can reduce the risk of sexually transmitted infections, STIs, that can harm the reproductive system. Regular STI screenings are important for sexually active women. Avoiding harmful substances, smoking, excessive alcohol, and recreational drugs can negatively impact fertility and overall reproductive health. Limiting these substances can improve chances of conception and a healthy pregnancy. Managing stress. Chronic stress can affect hormone levels, menstrual cycles, and overall fertility. Managing stress through mindfulness. Question: what is endometriosis? And how does it affect health? Answer. Endometriosis is a chronic medical condition where tissue similar to the lining of the uterus, endometrium, grows outside the uterus. This tissue can be found on the ovaries, fallopian tubes, the outer surface of the uterus, or other organs within the pelvis. In rare cases, endometrial-like tissue can even be found in areas outside the pelvis. Each month, during a woman's menstrual cycle, this tissue behaves like normal endometrial tissue, thickening, breaking down, and shedding. However, because it is outside the uterus, it has no way to exit the body. This leads to inflammation, scar tissue, and the formation of adhesions, which can cause pain, fertility issues, and other complications. The most common symptom of endometriosis is pelvic pain, often severe, especially during menstruation. This pain can sometimes be felt in the lower abdomen, lower back, or during or after sexual intercourse. Other symptoms may include heavy menstrual bleeding, irregular periods, pain during bowel movements or urination, and gastrointestinal issues like bloating, constipation, or diarrhea. In some women, endometriosis can lead to infertility, as the abnormal tissue can interfere with the reproductive organs. The exact cause of endometriosis remains unclear, but it is believed to involve a combination of genetic, immune system, and hormonal factors. Women with a family history of the condition are more likely to develop it, and it tends to affect women during their reproductive years, although it can occur at any age. Diagnosis often involves a pelvic exam, ultrasound, or laparoscopy, a surgical procedure that allows doctors to view the endometrial-like tissue. While there is no cure for endometriosis, treatments like pain management, hormone therapy. Question: what are the risks associated with pregnancy? Answer: pregnancy, while a natural and beautiful process, carries certain risks that expectant mothers should be aware of to ensure a healthy experience for both the mother and the baby. These risks can vary based on individual health, lifestyle factors, and any pre-existing medical conditions. Some of the common risks associated with pregnancy include gestational diabetes. This is a form of diabetes that develops during pregnancy and can affect the mother's ability to process sugar. If left untreated, it can lead to complications like high birth weight, premature birth, and an increased risk of type 2 diabetes later in life for both the mother and child. Preeclampsia, a condition that typically occurs after the 20th week of pregnancy. Preeclampsia involves high blood pressure and signs of damage to other organs, often the kidneys. It can lead to serious complications such as premature birth or maternal organ failure if not managed properly. Miscarriage, or spontaneous abortion, is the loss of pregnancy before the 20th week. The risk of miscarriage is higher in the early stages of pregnancy, especially for women who have a history of miscarriages or certain medical conditions. Ectopic pregnancy. An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, usually in the fallopian tube. This can be a life-threatening condition as it may cause the fallopian tube to rupture, leading to internal bleeding and requiring emergency medical treatment. Preterm labor. Preterm labor occurs when the body starts preparing for birth before 37 weeks of pregnancy. Premature birth can lead to health challenges for the baby, including respiratory issues, developmental delays, and long-term health problems. Infections. Pregnant women are more vulnerable to infections due to changes in their immune system. Question: what lifestyle factors can reduce cancer risk? Answer: reducing cancer risk involves a multifaceted approach to lifestyle choices that promote overall health and well-being. Here are some key factors to consider. Healthy diet. Consuming a diet rich in fruits, vegetables, whole grains, and lean proteins can help lower cancer risk. Foods high in antioxidants, vitamins, and minerals contribute to cellular health and combat oxidative stress. Limiting processed foods, red meats, and sugary beverages is also advisable, as they have been linked to certain cancers. Regular physical activity. Engaging in regular exercise not only helps maintain a healthy weight but also supports immune function and reduces inflammation. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity weekly, along with muscle strengthening exercises on 2 or more days. Weight management. Obesity is a significant risk factor for several types of cancer, including breast, colon, and endometrial cancers. Maintaining a healthy weight through balanced nutrition and exercise is crucial in reducing this risk. Avoid tobacco. Smoking and the use of tobacco products are the leading preventable causes of cancer. Quitting smoking and avoiding secondhand smoke can dramatically lower the risk of lung cancer and many other cancers. Limit alcohol consumption. Excessive alcohol intake has been linked to various cancers, including liver, breast, and colorectal cancers. Limiting alcohol to no more than 1 drink per day for women and 2 for men can help reduce risk. Sun protection. Ultraviolet (UV) radiation from the sun increases the risk of skin cancer. Wearing sunscreen, protective clothing, and avoiding tanning beds can help protect your skin. Question: how can you protect your skin from sun damage? Answer: protecting your skin from sun damage is essential for maintaining overall skin health and preventing premature aging, sunburn, and skin cancers. Here are several effective strategies you can implement. Use sunscreen. Apply a broad-spectrum sunscreen with an SPF of at least 30, even on cloudy days. Reapply every 2 hours, or more often if swimming or sweating. Sunscreen should be applied generously to all exposed skin. Wear protective clothing. Opt for clothing that covers your arms and legs. Long-sleeved shirts, long pants, and wide-brimmed hats can provide physical barriers against UV rays. Look for clothing with an ultraviolet protection factor (UPF) rating for added protection. Seek shade. Whenever possible, stay in the shade, especially during the peak sun hours between 10 a.m. and 4 p.m. Trees, umbrellas, or canopies can provide relief from direct sunlight. Avoid tanning beds. Tanning beds emit UV radiation that can damage your skin just like the sun. Avoiding these devices can help protect your skin from harmful effects. Know your medications. Some medications can increase your skin's sensitivity to sunlight. Consult your healthcare provider about any medications you are taking and how they may affect your skin. Get regular skin checks. Regular dermatological checkups can help identify any changes in your skin and catch potential issues early. Be aware of your skin and monitor any new moles or changes in existing moles. Hydrate and nourish. Keeping your skin hydrated with moisturizers and drinking plenty of water can help maintain its integrity. A healthy diet rich in antioxidants can also support skin health. Limit sun exposure. Plan outdoor activities for the early morning or late afternoon when the sun's rays are less intense. Question: what are the benefits of quitting smoking? Answer: quitting smoking has numerous benefits that positively impact both physical and mental health. First and foremost, one of the most significant advantages is the reduction in the risk of developing various chronic diseases. When you stop smoking, your chances of developing heart disease, lung cancer, and chronic obstructive pulmonary disease (COPD) decrease significantly. In fact, within just a year of quitting, your risk of coronary heart disease is halved compared to that of a smoker. Moreover, quitting smoking improves lung function and respiratory health. After just a few weeks, your lung capacity begins to increase, making it easier to breathe and engage in physical activities. This enhanced lung function can lead to an overall boost in stamina and physical performance. The financial benefits of quitting smoking are also substantial. Smokers spend a significant amount on cigarettes, and by quitting, they can save thousands of dollars each year. This money can be redirected toward healthier habits, hobbies, or even vacations, contributing to a more fulfilling lifestyle. Additionally, quitting smoking has immediate effects on your well-being. Many individuals experience improved sense of taste and smell, allowing them to enjoy food more fully. Your skin also begins to look healthier as blood circulation improves, and the risk of premature aging decreases. From a mental health perspective, quitting smoking can lead to reduced stress and anxiety levels. Although many smokers believe that cigarettes help them manage stress, research indicates that smoking is more likely to increase anxiety and tension. By quitting, you can break this cycle and develop healthier coping strategies. Finally, quitting smoking sets a positive example for those around you, particularly children and family members. Question: how can you maintain a healthy weight? Answer: maintaining a healthy weight is essential for overall well-being and can significantly reduce the risk of chronic diseases. Here are several strategies to help you achieve and maintain a healthy weight. Balanced diet. Focus on a diet rich in whole foods, including fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid highly processed foods that are often high in sugar, salt, and unhealthy fats. Portion control. Be mindful of portion sizes. Eating large portions can lead to consuming more calories than necessary. Use smaller plates or bowls to help control portions. Regular physical activity. Incorporate regular exercise into your routine. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity each week, along with strength training on 2 or more days. Stay hydrated, drink plenty of water throughout the day. Sometimes, thirst is mistaken for hunger. Staying hydrated can help control your appetite and improve metabolism. Mindful eating. Practice mindful eating by paying attention to your hunger cues and eating without distractions. This can help you enjoy your food more and recognize when you are full. Set realistic goals. Set achievable and realistic weight loss or maintenance goals. Aim for gradual changes rather than quick fixes, which are often unsustainable. Get enough sleep. Aim for 7 to 9 hours of quality sleep per night. Lack of sleep can disrupt hormones that regulate hunger and appetite, leading to weight gain. Manage stress. High stress levels can lead to emotional eating. Practice stress management techniques such as yoga, meditation, or deep breathing exercises to help you cope without turning to food. Regular monitoring. Keep track of your weight and eating habits. Regular self-monitoring can help you stay accountable. Question: what vaccinations do adults need? Answer: vaccinations are not just for children, adults need them, too. Keeping up to date on vaccinations is crucial as we age, as it helps maintain immunity against certain diseases and protect overall health. Here are some essential vaccines recommended for adults. Flu vaccine. The influenza virus changes yearly, so adults should get the flu shot annually. This is especially vital for people over 65, pregnant women, and those with chronic conditions, as they are at higher risk for complications. Tdap/TD booster. The Tdap vaccine protects against tetanus, diphtheria, and pertussis, whooping cough. After the initial Tdap vaccine, adults need a TD booster, tetanus and diphtheria, every 10 years. Tdap is also recommended for pregnant women during each pregnancy to protect newborns from whooping cough. Shingles vaccine. Shingles, caused by the reactivation of the chickenpox virus, can be very painful. Adults 50 and older should get the shingles vaccine to reduce the risk of developing the disease and its complications. Pneumococcal vaccine. This vaccine helps prevent pneumonia, meningitis, and bloodstream infections. Adults 65 and older, and younger adults with certain health conditions, like heart disease, diabetes, or weakened immune systems, should consider getting this vaccine. COVID-19 vaccine and boosters. Staying protected against COVID-19 is essential, especially for high-risk groups. The specific recommendations for boosters may change as new variants emerge, so checking with a healthcare provider for current guidelines is important. Hepatitis A and B vaccines. Hepatitis vaccines are recommended for adults who might be at higher risk, such as those with chronic liver disease, healthcare workers, or anyone at risk of exposure through travel or lifestyle factors. Question: what are the signs of high blood pressure? Answer: high blood pressure, or hypertension, is often dubbed the silent killer because it usually doesn't present noticeable symptoms until it has reached a severe stage. However, there are several signs and symptoms to be aware of that may indicate high blood pressure. Headaches. Frequent or severe headaches can occur, particularly if blood pressure is extremely high. They may feel like a pulsating pain or a feeling of pressure. Dizziness or lightheadedness. People with high blood pressure may experience feelings of dizziness or lightheadedness, especially when standing up quickly. Nosebleeds, although they can happen for various reasons. Frequent nosebleeds can be a sign of elevated blood pressure. Shortness of breath, difficulty breathing, especially during physical activity or exertion, can be linked to high blood pressure, indicating potential cardiovascular strain. Chest pain. This is a serious symptom that can suggest that high blood pressure is affecting the heart. If you experience chest pain, seek immediate medical attention. Blurred vision. Vision changes or blurred eyesight can be associated with hypertension, particularly if it has led to damage in the blood vessels of the eyes. Fatigue. Unusual tiredness or fatigue may occur as your body struggles to cope with the strain high blood pressure places on your cardiovascular system. Heart palpitations. Some people report an increased awareness of their heart beating rapidly or irregularly. It's crucial to understand that many people with high blood pressure may not exhibit any symptoms, which is why regular screenings and monitoring are essential for early detection and management. If you suspect you may have high blood pressure or are at risk, it's vital to consult with a healthcare professional who can assess your condition and recommend appropriate lifestyle changes or treatments. Question: how does smoking impact health? Answer: smoking has a profound negative impact on health, affecting nearly every organ in the body. One of the most significant consequences of smoking is its role in causing various forms of cancer, particularly lung cancer. Studies show that smokers are 15 to 30 times more likely to develop lung cancer than non-smokers. This increased risk extends to cancers of the mouth, throat, esophagus, bladder, and pancreas. Beyond cancer, smoking is a major contributor to cardiovascular diseases. It damages blood vessels and can lead to atherosclerosis, where arteries narrow and harden, increasing the risk of heart attacks and strokes. Smokers are twice as likely to have heart disease compared to non-smokers. Respiratory health is severely compromised by smoking as well. Chronic obstructive pulmonary disease, COPD, which includes chronic bronchitis and emphysema, is predominantly caused by smoking. Symptoms of COPD include chronic cough, shortness of breath, and wheezing, which can significantly reduce quality of life. Smoking also weakens the immune system, making the body more susceptible to infections and illnesses. This immune suppression can lead to prolonged recovery times from illnesses and surgeries. Additionally, smoking has detrimental effects on mental health. It is associated with increased rates of anxiety and depression. Many people smoke to cope with stress, but this creates a vicious cycle. As the act of smoking can lead to increased stress and anxiety levels. Furthermore, secondhand smoke poses significant risks to those around smokers, particularly children and non-smoking adults, leading to respiratory issues and increasing the risk of various health problems. Quitting smoking at any age can significantly improve health outcomes. Question: what are the benefits of routine dental checkups? Answer: routine dental checkups are essential for maintaining not only a bright smile but also overall health. Regular visits to the dentist help in early detection of potential dental issues, such as cavities, gum disease, and oral infections, which can be treated before they become serious. Dental checkups typically include professional cleanings, which remove plaque and tartar that regular brushing and flossing may miss. This deep cleaning helps prevent tooth decay and gum problems, contributing to long-term oral health. Moreover, dentists can identify early signs of oral cancer, a disease that's often overlooked in its initial stages. Early detection significantly increases the chances of successful treatment, and routine checkups provide this critical opportunity. Gum disease, another common issue, can lead to tooth loss if not properly managed. Regular checkups allow dentists to monitor gum health and provide preventive or corrective treatments, which are especially crucial for those at higher risk due to factors like smoking or diabetes. Routine dental visits also play a role in heart health. Studies show that gum disease is linked to conditions like heart disease and stroke. By managing gum health through regular checkups, you may reduce your risk of these serious health issues. Additionally, the bacteria from untreated oral infections can enter the bloodstream, potentially leading to infections in other parts of the body. Therefore, maintaining oral hygiene through dental checkups may protect against systemic health problems. For children and adolescents, regular dental visits help with monitoring the development of teeth and jaw alignment. This is especially helpful as it allows for timely orthodontic interventions, such as braces, if needed. In adults, these visits help detect age-related issues like dry mouth. Question: how often should you get screened for cancer? Answer: cancer screenings are crucial in detecting the disease at an early stage, significantly increasing the chances of successful treatment. The frequency of these screenings depends on various factors, including your age, family history, gender, and risk level. Here's a general guideline to help you understand how often different cancer screenings are recommended. Breast cancer. For women at average risk, it's generally advised to start mammograms at age 40 or 50, continuing annually or every 2 years until age 74. For women at high risk, due to family history or genetic factors, screening may start earlier and include additional tests. Like MRI scans, cervical cancer, women should begin screening with pap smears at age 21, repeating every 3 years if results are normal. From age 30 to 65, a combination of a pap smear and HPV test every 5 years is recommended, or a pap smear alone every 3 years. Women over 65 with a history of normal results may not need further screenings. Colorectal cancer, starting at age 45 for those at average risk, screening options include a colonoscopy every 10 years, a stool test annually, or a sigmoidoscopy every 5 years. People with a family history of colorectal cancer may need to start screening earlier or get tested more frequently. Lung cancer, adults aged 50 to 80 with a history of heavy smoking, about 20 pack years or more, or who currently smoke or quit within the past 15 years should consider annual low-dose CT scans. Early screening is key for high-risk individuals, but is not recommended for everyone due to radiation exposure. Prostate cancer, men aged 50 and older, or those aged 40 to 45 at higher risk, like African American men. Question: how can regular health screenings improve long-term health? Answer: regular health screenings play a crucial role in improving long-term health by identifying potential health risks early, allowing for timely interventions, and encouraging preventative care. Screenings are designed to detect issues such as high blood pressure, cholesterol levels, diabetes, and various cancers before they become more serious, making it easier to manage or even prevent the progression of these conditions. By catching potential problems early, individuals can take action sooner, which is often associated with more effective treatments and a better quality of life. One of the biggest benefits of routine screenings is early detection. Many chronic diseases, like heart disease or cancer, can develop slowly and often go unnoticed until they reach more advanced stages, where treatment may be more complicated and less effective. With screenings, these conditions can be detected in their early stages, sometimes even before symptoms appear, providing an opportunity to intervene earlier. For instance, regular blood pressure and cholesterol checks can highlight cardiovascular risk factors, prompting lifestyle adjustments or medication to manage these conditions proactively. Another significant advantage is that screenings promote preventative health behaviors. Regular visits to healthcare providers for screenings often serve as a reminder to maintain a healthy lifestyle, such as eating a balanced diet, exercising, avoiding smoking, and managing stress. Health professionals can provide personalized advice based on screening results, reinforcing the importance of maintaining healthy habits. This guidance empowers individuals to make informed decisions about their health, leading to long-term positive lifestyle changes. Moreover, screenings can help manage existing conditions more effectively.